everybody to introduce themselves whenever they speak so that we can associate a name with the speaker. With that in mind, this is Grant Ritter, chair of the committee. And the meeting is going to be recorded for minute-taking purposes, as well as posting the recording on the agency's website. Marcian, could we have a roll call of the attendance?
Yes, Dr. Ritter. Grant Ritter.
Here.
Pamela Rasek.
Here.
Thank you. Paul Philpott. Shelley Sweet.
Here.
Christopher McKernan. Ellen Skinner. Matthew Katz.
Here.
And Mr. Paul Lombardo, subject matter expert. Mr. Lombardo notified me that he will not be able, unfortunately, to attend today's meeting. Thank you.
Okay. Marcian, do I understand there is no public comment?
That is correct, Dr. Ritter. There is no public comment for today's meeting.
Okay. Moving on. Could we have a motion to approve the minutes from February 27th?
This is Matt. Oh, go ahead. Go ahead, Shelley.
Matt? Okay, Shelley moves.
Motion
Matt,
to approve.
a second.
I'll second it. This is Matt.
Too many things at once. Well, somebody seconded. Okay. Could we have a discussion? Any changes, edits, comments on the minutes? Okay. In that case, could we have a vote on the approval?
Grant Ritter.
Yes.
Pamela Rasek.
Yes.
Paul Philpott. Shelley Sweet.
Yes.
Christopher McKinnon. Ellen Skinner. And Matthew Katz.
Yes.
Thank you.
Okay. Great. Moving on. I'd like to turn it over to John Carbone to talk about the small individual group overview.
Thank you very much, sir. Appreciate it. Good afternoon, everybody. John Carbone, Director of Small Group Product Development and Broker Support. So today we're going to go talk about all the shop numbers. We're going to talk about different varieties of, the groups that we have and the plans they're enrolled in. The reason why I also have the individual group overview too is, how our team has changed and evolved into making sure that we find the best option for our employer groups, if that's on the individual side or the group side. So we felt it was necessary for you guys to see where this membership is going as they call into us and we work them through. We felt that was very important to demonstrate those numbers to you and kind of let you know our vision and what we plan on doing going forward. Also, too, we'll talk a little bit about the Connecticut Small Business Summit overview. We're really excited with that, and we're already started to talk about it internally. And as James mentioned in a previous conversation, we'd like to get everybody involved right now in the beginning phase of this. So when we do have this Connecticut Small Business Summit, we have a lot of the input from the Shop Advisory Committee meeting. Also, too, we're going to talk about ICHRA, Individual Coverage Health Reimbursement arrangements. We'll give you a quick update of where we stand in the RFP. The RFP is technically still open, so I'll be able to share enough information with you, but we'll kind of be able to let you know what's going on a little bit about there. And then Susan is going to talk about the Connecticut and Molina Healthcare pending sale. And then from there, we'll be all set. So right now, we'll talk about the year-over-year shop numbers for the small group plan. Currently, right now, we have 513 groups. It is a percentage of 17.9% increase year over year. The groups are getting smaller. We are dealing with a lot of micro groups coming through, and there is a reason for that. You'll kind of see it on the next couple of slides. We have about 1,271 subscribers. That has fell, and that's basically the statement of the groups are getting smaller and the membership has decreased by 4.2%. That may not sound like a good thing, but we'll give you on the next slide, you'll understand why. We're currently at 2,031. On the right side, we basically gave you a quick breakdown of where the plans are going and what employer groups are purchasing. And as you can see, they are purchasing the rich plans. They are telling us we want the better benefits, and they're purchasing the gold plans and the silver plans, and the bronze plan comes in a third place from bronze HSA plan is in the third place with the the lowest plan being the bronze pathway. And the Connecticut Small Business Employers are saying, hey, we want these benefits. We need these plans. We want plans with more benefits. Susan, correct me if I'm wrong, but for for 2025, Anthem will be reintroducing a 6th plan, and that will be the Platinum plan that will be rolling out for the new year. So we're excited to have that option. We feel like it gives us a little bit more stability in being able to provide different types of benefits. So benefits that'll have less out-of-pocket exposures for our employees, the employees throughout the group. So we are excited about that opportunity. Does anybody have any questions on this slide?
This is Matt. I have a question.
Sure.
You said Anthem was offering, are they only offering the Platinum or are they offering all plan options?
No, they're going to offer 6 in total. So the 5 plans you see in front of you, with the Platinum plan being the 6th plan option for small group.
Thank you.
You're welcome. All right, Marcin, next slide.
Oh, wait,
So
I have a question. I'm sorry. I raised my hand, but I didn't want to.
Oh, no, go ahead, Shelley. I'm sorry.
And you
Jump
may
in.
be covering this elsewhere. So if so, just tell me to wait. But do you have information on how the contribution employer-employee breakdown comes in with employers choosing these richer plans?
So
Do you know what
we
I'm saying? What I'm asking?
Yeah, we tend not to get a ton of that information from the broker. We usually, will help out if we're requested by a broker, but usually the broker kind of handles the contribution structure. But here's my understanding and what we're seeing, because we do ask a little bit, because it's just kind of important for, our team to understand what to present to our brokers and then some of the employers. It's really most of the small businesses are contributing 50% of the plan. Do they do benchmark plans? Yeah, they do. They'll create a benchmark plan. Sometimes the bronze, being the benchmark plan and allowing them to buy up. But mostly we have groups that are just coming in asking for a gold plan. We provide them the entire suite, but a majority enroll, as you can see, into the silver and the gold plan.
Thank you.
You're welcome. All right, Marcia, next slide, please. So we wanted to just let you know, give you a kind of a quick breakdown of the shop demographics and age-wise. And as you can see, it's pretty comparable over males and females. We have a pretty good balance of the book. Most of our membership is in that 19 to 54 range, which makes sense. That's the big demographic swing. But as you can see, it's 21% versus 13%. So from 19 to 34, it's 13.5% for males, and and 21.9% for 35 to 54. So most of that membership fits in there, and that's the benefits across the board. That's really how small group is across the board with it. It's a lot more of an aging population. I don't need to tell you guys. Some of you guys deal with the population out there, Shelley and Chris. They're used to that, and they see that. We do have an older population here in Connecticut, and we have a lot of blue collar workers. So that's why. But to have a good split like that is a good risk balance for the platform itself. Yep. Shelley, you still up? Or is that from the last time? There we go. All right.
Last time.
I want to make sure. All right, Marcin, next slide. So where are our members located? As you can see, very surprisingly, we are pretty much third with Anthem in Fairfield County on competitive pricing. But we have most of our membership is there between Fairfield and Hartford. As you can see, 569 members, and Hartford 528 members, and New Haven is 378. So that belt line still exists, still happens here in the state. Straight up, 91, 95 is where our membership is, and we've been trying to push out to the Litchfields and Middlesex and Wyndhams and New London and Tollens. But most of that membership has been gearing and going towards the individual side. We find that those individual members in those plans, the individual side is the best fit for them, and we start pointing them in that direction because it's just going to save that employer money and that employee money, and they have better options to get different types of plans. So we'll work with that broker or that employer group directly to make sure we help them out on that. Martin, next slide, please. So these are the SIC codes where most of our industries and our groups are coming. And as you can see, it's spread out across the board, but this is kind of our top, 6, 7, construction, auto parts, sales, services, food and beverages, pharmacies and pharmacists, home services, education and childcare, and then retail is a big part of this too. The construction also, some of those SIC codes sit in there as manufacturing companies also. So we felt it was necessary just to show you where our business is coming from. And, we're starting to ask for this information and validating it. And if they don't provide it to us, we tend to look for it and just make sure we populate the stuff, because we're able to look up this stuff and on the net through Google and be able to find what we need to find for the SIC code. We felt it's just important for us to track it, to know where our business is coming from and how we can help them out best to make sure their plan fits their needs. Yep.
This is Matt. I'm going to take my hand down. Have we looked at where we're seeing the attrition in which of these subsets? If I recall, at one point, physician and pharmacy was higher up, and some of these others were lower. And if we're seeing attrition in these particular SIC codes, are they ending up in the individual market for you, or are they ending up gone? I mean, that where they're going is important for, because obviously if they're still staying with Access Health, that's a good thing, because we know that people are getting access and coverage. If they're not, then that's something I'd be concerned about. So knowing where they're transitioning to would be helpful.
Thank you for the lead in, Matt. I appreciate that. Marcia, next slide. As we go through the enrollment process, Matt, what we do is we evaluate each member, even at the time of renewal and at the time of the sale. And we try to make sure that if, the option for them, last year was a group side, this year it may not be the group side. It may be the individual side, because the percentage increase on the individual side is lower. The plans, they have more plan options. So we evaluate that on both sides, on a new sale side and a renewal side. And if we have an employer that basically says, we can't afford this anymore, there are different options, we looked out in the marketplace, what would you consider? We tend to, a lot of moving these groups, they do go to the individual side, Matt. So as you can see, year over year, we're continuing to grow those members to come over into the individual side to purchase an individual plan. We're tracking these to make sure we keep them around. A lot of these employers are also talking about, HRA plans and individual plans that they've kind of set up, individual HRAs with them on the side. We're excited to be able to offer them an ICHRA solutions in the future, and we think that's going to help that. But as you can see, we are moving the membership over to the individual side. Are we losing some membership to partially self-funded? Absolutely. We're definitely doing that. But we are starting to keep track of that membership that does come back, because we kind of want to know if it's coming back from partially self-funded, why? And again, and we've kind of heard this story, and I've kind of made this statement around, eventually they will come back. It's just a law of numbers. It's kind of, they'll have some bad claimants, and they'll have to come back into the fully insured market if they're finding a cheaper rate and back in the fully insured. Pam?
The only thing I was going to ask was, and you answered it, like, were we tracking it? And it sounds like it's in its early stages, so it probably won't be another year or so before we start to really see anything that looks like a trend, but I'm glad that we are tracking it.
Yeah, we definitely need to track it, because it's important. We want to be able to show value, be able to show that, hey, just because you're coming to us and asking us for a small business code, we want to make sure that we're giving you all the avenues. And like before, there are opportunities where we basically say, hey, this is the best plan for you. It may not be on exchange, and it may be someplace different. They'll come with their proposal, and we'll evaluate it for them. And they'll ask us to. And we tend to say, make sure you talk to your broker and walk through this. But I think your broker's pointing you in the right direction, and that may be a different option. Again, we just want to make sure that they're enrolled. They're enrolled in the best option, and they have, and they're able to afford it, make those monthly payments, and keep those employees insured.
Yeah, I guess the other comment I would make is, I think this is a mark of an incredible amount of maturity in this organization from its roots in terms of where we started. And the whole idea of the mission being to make sure that we increase coverage and access within the state. And I do think that, being able to, we kind of started out where we had a lot of shop specific focus, and not that we shouldn't maintain it, but the idea that we're continuing to make sure that coverage is available to people regardless of which door they go in, I think is absolutely the right thing. And I'm really pleased to see this.
Excellent. Thank you very much, Pam. Appreciate those comments.
I'd like to follow up if it's okay. This is Matt on Pam's comments. I agree wholeheartedly, and I wonder if there's even something more for us to say or do with this information, because if someone were to just look at the shop numbers, they may say that we are maybe not representing those small businesses well, but when you look at this, we clearly are, and you clearly are, by directing them to a plan that's best for their employees. And so if there was a way to highlight this when you highlight the shop numbers, and maybe you do, and I apologize, but I mean, adding this into the shop, you're helping almost 8,000 employees in the state. It's not the 2,000, it's almost 8,000. And so I just think if there's a way to maximize these numbers more effectively to show that shop is helping, and I know it's all access health, so I'm not trying to differentiate, except I think it's important to accentuate the business support that you are providing. And if there's any way to do that using these numbers, I would recommend doing it.
Yeah, I appreciate that. Yeah, thanks for your comments on that, Matt. Yeah, that's our goal to go forward. We want to make sure that we're telling everybody what we're doing with the small business. And I think ICRA is also going to show that, and we'll be able to track it and demonstrate those numbers to see what we're doing for the Connecticut residents, small business and individual members, to make sure that we help them out. So I think more to come on that, especially with ICRA too. You're going to start seeing, demonstrating, showing those numbers more.
So Matt, you're absolutely correct, Matt. What we're going to do going forward on the shop deck that John just showed you guys, we'll add dates, but with a note that that these folks that are enrolled in the through shop, but they are enrolled in the individual business. And ICRA is going to blow this up. And when John gets to ICRA, we have an update on ICRA where we are, then what the future prospects looks like for ICRA, for small businesses in particular going forward. But you have to be correct. The total population of shop enrollment is really over 8,000, not the 2,000 and change that we should show. So going forward, we'll have it all on one slide so that's complete. It's the complete picture for the committee. And by the way, Pam, thank you for those comments. As John indicated, our core mission is to lower the uninsured in Connecticut and help address health disparities. That's why our strategic focus is, we don't care where you enroll. We just want to make sure everyone has access to health insurance and they are enrolled.
Right.
That's
right.
our primary focus.
Right. I remember that from the very beginning. And I think this is a real clear demonstration, like I said, of the maturity level in terms of meeting that mission. And it's a credit
Absolutely.
to the work that this group has put in. So applause to you guys.
Thank you much.
All right. So I think it's important for us to tell you where these members are going. So we basically broke it down by the carriers. So as you can see, we will be adding another step to this. Unfortunately, I wanted to be able to share to you which, these members are going to, how many people out of these members are getting APTCs, who are not, be able to show you a percentage. So stay tuned on the next time. We're going to evolve this slide to provide a little bit more information for you, where these places, where these individuals are located, just so you kind of get a good understanding. I think you're probably going to see the demographics looks pretty similar to the small group side. But I think it's important that we show how many of these, 5,300 members are getting advanced premium tax credits, who are not, in a percentage, just kind of so we can get a good feel of it. And the main reason why we moved them either from a small group plan or we pushed them to an individual plan is because they were able to get more APTCs than they were able to get contributions. So that alleviated some stress for the employer, and it allowed that member to alleviate some stress out of their pocket, potentially having to pay less. And with the family glitch fixed, it potentially helped out that family unit, but also giving them the option to be able to purchase a plan and be eligible to look at all 22 plans versus 5. So now they can pick the best plan that fits their needs. So this, as you can see, demonstrates where most of the membership is. It's a pretty good balance between Anthem and Connecticut with the products going across. So as you can see, the silver plan is the winner on this side of the fence. And that's rightfully so on how that's set up. Yes, Pam?
Do we have any, do we anticipate any impact of the Molina acquisition of Connecticut on any of this?
So we have a slide at the end. Susan's going to give you a quick overview of that and be able to kind of talk a little bit about it.
Okay, thanks.
You know, can I go back? I'm sorry, John, one quick. It's interesting to note how many are taking advantage of the dental and vision benefits as well. Oh, you're on mute, John.
Sorry.
That's
I
okay.
apologize. I can give you rough numbers off the top of my head. As you guys know, Anthem has eliminated the individual plan, the group dental plan on our side of the fence. So what ends up happening as we did the integration on the individual side, we back about a couple of years ago had about a little under 2,000 to 3,000 members in there. Currently, right now, there's a little over 13,000 members that have been enrolled in the standalone dental plan on the individual side of it. Anytime we get a group, all our membership that we transitioned, we did transition them over to the individual side. Did we lose some of them to a Delta or a Guardian? Absolutely, but we made them aware of the plan options they had on the individual side. But as you can see, over the past 2 years, integrating it with our individual system has boomed those numbers up tremendously. So currently right now, I think it's around 13,000 and change that's enrolled in a dental plan. So I can share, I'll make sure that the next time we share those numbers too.
Yeah, and that's great. I mean, I think people forget that it's not just health, that the vision and dental is a part of it.
Yeah.
And making sure that, and I know it's not part of Anthem's group, but since we're encouraging employers for their employees to see the individual, it would be good to highlight that there is dental and vision available for them. You know, again, they have to look in a separate box on the Access Health site, but it's still there for an employer who cares about their employees and wants to find what's best for them.
Yeah, we also make them aware. It's a great point, Matt. We also make them aware of some of these plans have dental and vision baked into them, and we ask them if they're looking for something, take a look at that, because we don't want them to enroll in double insurance. So if they feel that that meets their needs and they're okay with the benefits and the structure and the network, then that's a good direction for them to go in. If they're looking for a little bit more of a robust plan because they're coming off of a dental plan and want to enroll on something on the exchange, that's a great option for them to go to a standalone because it waives all the mandatory waiting periods and they can just go right into benefits at a pretty decent price point.
I would just add, this is Susan, these plans that you're seeing here, Matt, some of them where they say added dental and vision benefits, to John's point, usually what they've done is they've added some adult dental benefits, generally preventative. So it may not be, I don't know that any of them offer full dental benefits like the standalone dental plans do. They are full benefits for children, obviously. It's an essential health benefit, but for the adult, it is some dental. And to John's point, you know, that may be what the employer is looking for. And the vision, obviously, is what they're adding, some vision benefits to these plans as well.
I think it's just another way of accentuating what Access Health is providing to employers and their employees. And I know, again, it's not offered as part of the employer model with Anthem, but at least there's a way for them to get access to it through the individual side.
Okay. We'll the next meeting, I've taken some notes down. We'll make sure that we come and we demonstrate and show those numbers for you. And we'll break them down to you and show you who they are, where they are, and we'll be able to provide you that information. All right, Martin, next slide, please. So here we just wanted to give you a quick overview of what's going on, where the dollar's coming, what we're bringing in. So with that being said, right now, currently our highest monthly invoice number is about right around 20,500 and change. Our lowest dollar amount is about $389. Our average invoice is about $3,000 year over year. We have collected more premiums for Anthem, 15.5 versus 18.6. So that is substantially has gone up on the group side. The membership has dwindled, and that's just a year over year increases that are being produced, which is creating that cost difference there. The great part too is our book of business currently is 78% of it is brokers. The groups that don't have a broker are kind of the micro groups, and micro groups can be classified a little bit different. For us, I'm basically using the terminology. It's usually the group for us 3 and under. They just come directly themselves to the portal and they enroll. Our job is to make sure that we do push them to a broker because we want to show them value. It helps them out throughout the renewals, but sometimes they just choose to enroll themselves right through it. Our renewal retention is at 82% year over year. That number has dropped from 88%. I'm not including the membership that we've kind of sent over to the individual side. We're trying to figure out how we can track that, but to blend those two together, that wouldn't be a true then renewal retention year over year. Even though we are keeping the business, it's just on a different side of the fence for us. But we're okay with that number because what we're dealing with the members and making sure they see a product on the individual side and helping them out that way. So we're okay with that, but we want to hopefully, with ICHRA and other things that we're going to be coming along, see our shop numbers grow. Hopefully that'll help us out a little bit too. We do feel that will help us in down the long run. So any questions?
Yep.
All right. Next slide, Marcin. A couple of slides in. So as you guys know, we have had the Connecticut Small Business Summit this year. Again, it's our second annual. We're really excited about the outcome. The reason why we developed this is after we came out of COVID, we felt that the employers needed some relief, needed some help to be able to manage this and get the right people in the room for them to collaborate, network, and be able to listen to other professionals on how they do their jobs. So with our partner Mints and Hope, every year we find a region that we want to be in. And this year we partnered up with the Chamber of Commerce of Eastern Connecticut. We had an incredible outcome. We had a lot of individual members that were there with vendor tables and all that. We also partnered up, just want to make clear too, with the Connecticut Food Share to where we did people who came in, they voluntarily donated money into a bucket, and we donated that money to them, and also as in lieu of purchasing a ticket, and they donated that, and we were able to raise some money for them. They were at the event. They were very grateful. They are going to be part of this event going forward. We were happy to have them there. They represented the Connecticut Food Share very well. We're going to be planning on going out there with them and, we're going through the facilities and also helping out. Next slide, Marcin. So we had over 225 plus attendees, and why we say pluses, we had an additional probably anywhere between 60 and 70 people managing the process and working out. So we did it at the Mystic Marriott out there in Groton. That facility was a nice facility. We had great accommodations. We had a lot of, Congressman Courtney was a main, basically sponsor about this, promoting it through a social media page and through his department. We had an incredible turnaround. We actually, opened up the window, I think, on a Monday, and we had to close registration down on a Thursday afternoon because we were sold out. So we're thinking this year it's time to, as James would say, we got to push the envelope up it and get more people in a bigger spot. But also with that comes is cost, and we need to make sure that we're respectable in managing that cost to value here. But we felt like there was great value in there. We had 28 different vendors, and all those vendors was everything from Connecticut grants companies that were basically sitting there talking about their grants to payroll companies to different types of venues that were just selling their, trying to pitch their products. And we had brokers on both sides of the fence, individual, group, and Medicare. So we were excited to kind of go through that. We also did the breakout rooms this year still. We had 4 breakout rooms with over 20 different speakers in those breakout rooms. We talked about marketing. We talked about tax credits. We talked about mental health. And we talked about the evolution of healthcare in Connecticut in some of those breakout sessions. We had some great feedback from that. We will share the link with you guys so you can see it. We've updated the website for Connecticut Small Business Summit. We updated the website with all these speakers, all the videos. You'll be able to see all the additional pictures that are in there. But all the breakout sessions were recorded, including the main area where we had some of our guest speakers was Congressman Courtney, Lieutenant Governor was there, and a few other individuals who attended. We were able to raise about $1,800+ for the Connecticut Food Share, so we are proud of that, and we're going to continue to do that going forward. So Marcin, next slide. Next slide, this is some of the individuals that were participating. Not all of them, it's just some of them. Could have been about 3 pages deep, but I didn't want to do that. We wanted to make sure we had a very roundabout, vendors. We if we did have duplicate vendors, we tried to find a different option for them or, put them on the next year. We wanted to make sure we had the SBA there. We wanted to make sure we had the Connecticut Small Business Boost Fund. We wanted to make sure that we gave our the employers or employees that came out there, we wanted to make sure that we gave them options so they can have good balances and get great information. So this was just some of the vendors that participated in the event, not all of them. We do have a whole list of them straight through on the website.
John, did we charge anyone for the booths or what did we, or no?
No charge, sir. So what we would just basically doing anything that we did throughout the year in cost savings, we have this budgeted it out for the entire year, and we were able to basically pay for it all. We're trying to stay away from that, but eventually, as this gets bigger, we are going to have to start. We are going to have to start probably going down that route.
If you want a bigger venue and you open it up to more people, I think you're going to have to. And charging a little bit seems to make sense, or at least have them make a contribution to Connecticut Food, Share, something that would, not limit them, but encourage them to contribute and cover something. I missed this one. I had signed up, but I forget what happened, but something happened family-wise where I wasn't able to come. But this is a great mix of companies. I applaud you guys for the groups, and I love these things, and I think that I know you guys, it's a lot of work, but if you could do more of this throughout the state, I think getting people engaged, and you did it in a place where we don't have as much pickup of the small business side, so that was great too.
Thank you. Appreciate the feedback. Yeah, I think our little test pilot was basically the contributions at the door. We wanted to kind of see we wanted to see the feel if we did charge a small nominal fee to be participating in the event. And we think we can, but we just have to figure out, size and cost going as we get bigger, because our waiting list was about 175. So did we move some people out of the waiting list yet? Because one of the things that we learned from last year to this year is we had individuals opt in, and then we notified them, and then we emailed them, and then 3 to 5 days before we say, are you still attending this event? If you're not, please let us know, because we do have a waiting list. And we were able to get a good majority, a portion of the waiting list individuals in, which kind of helped out around the board. So we didn't have just dead spaces and people not showing up and on the list. So we were excited about that. And we're going to continue to evolve from that. But as I said in the beginning of this conversation, at our next Shop Advisory Committee meeting, part of the agenda is going to be talking about what we want to do next year and get your input for this, so we can start working on that progress going forward. Because booking one of these spots and speakers and all that, especially during open enrollment too, we've got to get working on it now, so we're not cramming so much work in a short period of time. But as you can see in some of these features, there's some of the speakers, as I said, Congressman Courtney, some of the panels we've had. Our guest speaker, oh my God, I'm forgetting her name right now. She was Women's Business Association Council. I'll get her name and email it out to everybody. I apologize. Her name is slipping my brain right now. But we also had, Lieutenant Governor was there and did a speech. So we're very grateful of everybody who participates and comes around. And we feel like we definitely need to evolve this a little bit more. As James would say, it's time to go a little bigger. All right, Marcin, next slide. All right, so individual coverage health reimbursement arrangements. Here's our quick update. As many of you know, we went out to an RFP. We did get a number of individuals that have gone through it. Our team has completed the scoring process. we are in the process of evaluating all those different types of platforms and what we can do and what our direction is going to be going forward on this. We are, as we go, and I kind of tell everybody, we've been working on this a couple of years just to kind of watch this and see where the market has grown. 3 to 4 years ago, the technology just wasn't really up to par. Has it improved? Yeah, it hasn't improved. But I always say Connecticut is a little bit of a different place, a little bit its own beast. And we need to make sure that this platform is the right fit for our Connecticut brokers, because really what we're doing is we're building the platform for our brokers, employers, and the employees. And we want to make sure it has all the necessary tools and take this complicated product and simplify it and make it so easy. James always says, we all know what what a 401k does. We just don't know what it does behind the scenes. We know you pick these little, packets. We want to make it streamlined, easy like that, so someone can make a decision based on, that kind of same concept, but being able to see those different types of options. So right now, what we're planning on doing is hopefully finalizing a few things up in the next, 5 to 10 business days with this, and then be able to kind of express to the committee and everybody which direction we're going on. We are planning on doing a soft launch for 11/1, and that soft launch will be a small portion of a few groups. We're going to focus in on non-for-profits and use them to help us make sure that the platform that we plan on rolling out in Q2, Q3 has all the necessary information. It's streamlined, it's easy. It's easy for someone enrolled. They're not spending a half a day doing it, and we're meeting all the requirements from the IRS to CMS and to our security and compliances. So this is a really complicated product. We plan on rolling this out. Right now, the vision is to make sure that everybody can come in, a broker and employer can come in, do a quick estimate, be able to walk through there and see if ICHRA is a good fit for them, and being able to handle everything from the enrollments to payments to the carriers to all the documents and plan documents that are required, notices that are required from the IRS, and where it's a very heavy broker-driven product, because in this market is driven by brokers. So that's kind of our vision. A lot of the ICHRA platforms are out there, are geared a little bit different. So that's kind of the thing we're trying to figure out. A lot of these platforms want to take the BORs. We're not interested in that. We don't want that. That's not our field. That the brokers do their job, they do it well, and we want to leave it in that. So we're trying to figure out what's going to be the right fit going forward. We have made our carriers aware of this. They are aware of it. We're going to continue to move forward with this. We feel like this is going to be a great tool in the toolbox for us. And I think our broker community is going to think the same thing also, because it's going to help them with different types of options and allow them to see different options to where we don't create an additional expense for the broker or the employer. And that employer can potentially save some money, that employee can potentially save some money, and be able to look at different types of options and have more choices. We always say the easiest thing for an employer is when you find the best plan for that employee and they enroll and they're able to save money, there's no one knocking on that HR door or that employer's door to say they don't like their plan because they have the right fit. So stay tuned on that. There's going to be more to come probably at the next meeting, which we'll kind of try to see if we can get on the books before open enrollment starts. I think it's important we give you a quick update on where we stand, and we'll have more information that we'll be able to share publicly. Any questions?
I have a question.
Yes, ma'am.
Can you hear me? It's Shelley. Okay.
Yeah.
So two quick, one comment, one question. Comment is, as a broker, there's no question that the broker community is looking for this, because compliance-wise, this is very complex. And having all those pieces, and so that they just have to tap in, I think would be a huge hit. So that was my comment. My question is the plan, are you planning for the full suite of individual plans to be available? In other words, because I'm assuming you're going to make it. Yeah. Go ahead.
Yeah. On exchange, absolutely. The full suite's going to be there.
Yeah.
Yeah.
Awesome. Okay.
So
So I'm just thinking,
definitely
planning ahead. If you had people there, they could be already, before the ICHRA is even there, they could be looking at that sort of suite of options that they would have to choose from. That's why I was asking.
Yep. Absolutely. Nope. So we plan on having that whole entire suite available to them so they can look and find the best thing. We're talking about a decision tool that can help, an employee put in, say, hey, I take this prescription and this stuff. We're trying to figure out how to do that stuff without making it so complicated to where that employee, it's taking them way too long to enroll, because we know what happens when, it takes them way too long to enroll. They just either abandon it or they come back to the employer or you guys to finish it out for them. So we have a goal to make it simple, fast, but make sure we're gathering all the information that we need to gather.
Very exciting. Thank you.
You're welcome. Thank you.
My question was similar to Shelley's, only if you could let us know what that full suite is when you make the final decision, maybe sending out an email to the committee, just identifying what that is. Interacting with a lot of not-for-profits, I think this would be huge for them. And but understanding what those options are is probably going to take some education, because they haven't had access, and so understanding that ahead of time would be helpful.
Yeah, that's a great comment, Matt. So that's kind of the one things we're kind of working through right now. How to see the full suite. The suite's going to be all the 22 plans on the individual side. But what we're trying to do is we're trying to give it that group coverage, but be able to have that individual, be able to look at those individual plans. We look forward to seeing where the group and the individuals rate come up in the next probably month and a half. But as we kind of see, the individual rates are kind of a little in single digits, and the group rates are kind of in double-digit renewals. So the spread is starting to get there. So we feel like this is a great option for some employers and employees to potentially be able to save money and be able to find different types of options. But I don't need to tell you, this is a very complicated product, so we got to make sure we get it right. That's why we're doing the soft launch before we do the full-blown launch. But training and materials are going to be 100% what we're going to be doing with the broker community. It's mostly going to be broker driven. All our training is going to be done with the brokers. But we're still going to educate the public because we have to. It's what we do, but it's really broker driven.
Okay, I raised
Yes.
my hand, but I think you just answered my question. Because I was going to say, is there any thought of making people or requiring some kind of education or certification, right? Because I could definitely see people getting in over their heads without having the knowledge they need to be able to actually help somebody. So you just answered that.
Yep. So that's why we're gearing this product towards brokers. Listen, we know this marketplace right now is totally kind of, it's broker platform. As Paul said one day, 90% of all the small groups here, or groups in Connecticut, are with brokers. So this product needs to be created for a broker to be able to sell it to an employer, to make that employee have an easy enrollment. If the parameters and all the rules come into play and it works out for them, there's a lot of rules into this. So we need to make sure everything coordinates. So we're excited of where this is going to go. And how we're going to evolve this going, from years now to come. But this does give us another tool in the toolbox that will help out the Connecticut residents. And this kind of be that thing that, hopefully will show some, upside on helping people pick the right plan and put more money in their pocket versus paying deductibles and all that. So stay tuned on that.
Good work, team. It's such a long way. I feel like that the journey's come. More to go, but great stuff.
No, I agree 100%, Shel. That's definitely, I've got to give Nate a call to, Mr. Diaz a call to talk about a few different things, and this will definitely be one of them, because we definitely feel that association needs to be part of this. And we'd like to be part of it and presenting it in front of the whole association. So I 100% agree with you.
I'm sorry, I didn't, it was me, Pam. I didn't identify myself.
That's okay. Shelley asked the question though in the chat. So I was just
I put it in the chat. Sorry. Yeah.
So thank you very much. I appreciate that. All right. Any other? All right. I'm going to turn this over to Susan right now, and she'll kind of give you guys a quick little overview and go from there. Thank you, everybody.
Thank you.
Thank you.
Thanks, John. And it's really been a great discussion today at the meeting. So everybody probably knows, Molina Healthcare Inc. announced on July 23rd that they are acquiring Connecticut Holding Company. which owns the Connecticut subsidiaries. They're acquiring it from Emblem Health, and the deal is expected to close in the first half of 2025. What does that mean? The current plans that Connecticut filed for 2025, everything, continues in its rate review. As John mentioned, the final rates should be coming out from the insurance department probably in early September. And then everything gets loaded in and will be, in there for November 1st to be offered to consumers for January 1. The sale with Molina won't close, going into 2025. So there won't be any, impact right now. I would assume, they will do their planning on what they want to do, for the offerings in 2026 as to do with, brand, what they want to offer, all of that information. And so we've been, doing our research on Molina, and there is, Molina Healthcare Inc. is the parent, and it appears they have subsidiaries in each state that they participate in. Their primary business is in managed care, primarily Medicaid managed care and some Medicare managed care. I'd say about 80% of their business comes from that. And then they also participate in exchanges in some states where they have Medicaid managed care. So starting in 2025, Connecticut would be the first state that they're starting out in an exchange where they don't have currently have managed care. So we will be, watching how that all plays out. We look forward to hopefully having a good relationship with them, being a good partner. They are very interested, in the Connecticut market. And Connecticut is not offering, small business plans. So I think Matt maybe had asked something before. So it doesn't have any impact on the small business market, fully insured, but obviously in the individual space.
Can I ask a question? Is that all right?
Yeah, go ahead.
Sure.
Do we know if in those other states where they participate in exchange, if they're in the small business side at all, or are they only an individual?
I would think they're mostly an individual. I mean, their interest in their space, if you read their public, they're a public company, their public documents, they talk about government sponsored healthcare. So I think they really view, managed care, obviously, and then individual plans through exchanges. I'll have to check on that, Matt, but I don't believe they're in small group, but I will double check. And
Yeah,
they
I can-
really,
So Matt, just a quick update, heads up. We are doing a full assessment of Molina Healthcare, of where they are, who their management team is, and so that we could prepare to engage with them when the sale closes. So we do know that the current CEO is a former CFO for Aetna, and I work with him. Our chair of our board, Charlie, when he was at Aetna, worked with him. Some of you may remember Jim Wadley. According to that paper, Jim Wadley is the VP of Exchange Business. So we have that preliminary information, but we are doing a full assessment of the entire organization from start to finish, and how do they engage in other states where they are exchange with them. And I think most of the exchanges that they engage with other states are the FFM states, right? But I think they engage
primarily
across
a couple
the board.
of state-based.
Primarily FFM.
but- Yeah.
So there's a lot of information we're gathering. To answer your question is a very good one. It's an opening question for us about how they structure, what do they do, how do they do it, and who they engage with. So we're getting all that information so that we could best prepare ourselves. So when they fully take over Connecticut, we know so we can be best prepared to engage with them. And we look forward to it. We think this is good for us. We think it's good for Connecticut to have this big organization with a lot of resources. And we are also looking at, given the business model is that they are primarily in the managed Medicaid space. What does that mean for Connecticut going forward? So, once we have the full assessment of the organization, because we're doing that, our staff is doing that right now. We'll create a summary page, and we're planning to send it to the board after we discuss it among ourselves, send it to the board, and we'll share with this committee as well.
I mean,
sorry.
That's okay. Go ahead.
I was just going to say, a few of us met today with some of our colleagues from the Washington State Health Benefits Exchange. Molina has been a carrier on Washington's exchange since 2014, just to talk about their experiences and different things dealing with them over the years. And they generally, play in the low cost space. That is their space they look to for premium. So that, in Washington also has standard plans through their Cascade Care, which they call public option, and then allows non-standard plans. So that'll be interesting to see for 2026, what they might propose to offer on the individual market.
Yeah, this is Pam. I can also, I agree with the comments in terms of description of how they do business. When I was at Change Healthcare and they were a client, that's pretty much the space they were noted for, was their managed Medicaid. And typically, from competitive perspective amongst payers, they're really regarded as being in the managed Medicaid business primarily. That's how people think of them.
I thought the same thing. I think in Illinois, they do offer both gold and silver options in that market, which is good that they're willing to put their toes into some of those other options. But they do tend to be more of a government managed kind of entity. But maybe in Connecticut, we can get them to be on the business side as well.
Well, that's where I think having Jim kind of in a key role there may help us, given his past history with us. So, yeah.
Yeah, I agree. But thank you for the update, and I see this as an opportunity, not as a negative. So it's great that you guys are already starting to look at options and approaches to engage with them.
Agree. Yeah.
Matt, we completely agree with you, Matt. And more to come on that. And so as we move forward, we'll keep this committee updated. Thank you.
Thank you.
Definitely. And they may, come up with some innovative or, different options, non-standard plan options in the individual market that we have not seen, yet from our other carriers. So that could be interesting for our consumers as well.
Yeah, competition makes competition better. So hopefully.
Yes.
Mm-hmm.
Agreed.
All right.
Okay.
Grant, back
Any
to
other
you.
questions? Any other comments? If not, could I have a motion to adjourn?
Motion to adjourn. This is Pam.
Thank you.
Shelley, second.
Great. Okay. Can we have a vote?
A roll call. Grant Ritter,
Roll call. Yes.
Pam Brasek,
Yes.
Paul Philpott, Shelley Sweet,
Yes.
Christopher McKinnon, Ellen Skinner, Matthew Katz.
Yes.
Thank you.
Thank you, everybody. Great
Thank you.
meeting. Thanks a lot, John. Thanks a lot.
Bye.
Thank you.
You're welcome, sir.
Thank you all.
Thank you,
Thank you
guys.
very
Good
much.
job.
Bye now.
Bye-bye all.